Hello and welcome to the latest podcast, and I'm really pleased to be here in the acute medical unit, which opened last October and is scheduled to see 13,000 patients a year. We've got 135 really dedicated staff who look after these patients. This is very much part of our work around flow, where people who come into the emergency department who then need further assessment and perhaps diagnostics before it's decided whether they can go home with some kind of package of care and treatment regime, or whether they need to go on to one of our specialist medical wards is made. And so it's a fairly short length of stay on here, and the patients are often acutely ill. And the area I'm particularly in is a primary care admissions area. And so what happens is that as GPs start to see patients, perhaps in their own clinics, out in the community in the morning, and they realise that this patient needs more treatment or perhaps more diagnostics, they will send them into this very unit, bypassing the need to go through the emergency department itself. It's something that our GP colleagues have been really pleased about. And we've already forgotten about Easter. I hope you enjoyed it. But we had a fantastic initiative called Home for Easter, where we focused on over 40 clinical areas. We had well over 100 volunteers, both from within the organisation and outside the organisation, working on wards and in clinical areas to identify those things that could be done to make a difference to that very issue of flow. So it was a week of complete enthusiasm. There was a real buzz at the end of it. What we did is we made sure that we had the weekend in the middle of the week. So we started off midweek to midweek. There were a lot of learnings that we got from that. And those were about things that we could do within the hospital, where we know that one of our limiting factors is having enough medical staff in the emergency department for a long enough period over the 24 hours of the day. That's very much tied into our recruitment, where we, along with other trusts, are having real difficulty in getting senior medical people. But I'm pleased to say that we've recently made some new appointments and they will be starting shortly. That still leaves us some vacancies, so please, if you're interested and have the right qualifications, do go onto our website. One of the other areas is about the fact that we're not running fully 7 days a week, and that's again both within the trust but also outside of the trust, where things like care homes perhaps aren't geared up to receiving patients at the weekend in the same way as they are during the week. But similarly, all of our departments aren't open 7 days a week. And then finally, we know that we've got to do more with our partners to ensure that we can discharge people safely and appropriately, if at all possible, to their own homes, if not, to some kind of either interim placement so that they can have more therapies, or to an eventual placement such as a nursing home. So we're working with social care very closely on that. I am so pleased though that in the week of Home for Easter, we undertook performance at 84.5%, which was better than previously and is something we can absolutely build upon. And the real positive was that we had more discharges than admissions during the week, and we know that's showing that flow is beginning to work. But finally, I just wanted to say thank you to the hundreds of volunteers and to those people that really took part with such energy. We've put in a bid which has been accepted, and we are establishing a new clinical senior team who will be working 24 hours a day, 7 days a week, to allow the kind of focus that we had during Home for Easter from a dedicated substantive team. One of the key changes that we have already been proactively initiating is to bring together an integrated transfer team. Essentially what it is it's all of those people, whether they're in health or social care, who, if they work together as a single team, they can improve discharge arrangements. Now, what we've done is we've already brought that team together with a single management structure. The manager is going to be from the Foundation Trust, and they will be directly helping to support and manage people who are nurses, who are social care workers. They will be working with care homes, and they are not only going to be working on an integrated basis, but we are now housing them in a single integrated place where they will be hot desking, but they will be together so they can have those conversations about the individual people who they are caring for and supporting. That is a new unit that is going to be based on what was Ward A14, and we've had some lovely refurbishment done to make that a really suitable place for them to work to the benefit of discharge patients. On a completely different area, but one that is also a priority for us, it's around dementia care. And we have long had a dementia strategy, and we are continuing to make improvements around the needs of dementia patients, which are very holistic. And I'm pleased to say that as a result of voluntary fundraising, we have established and now opened a dementia cafe, which when you go into the area is a relaxed atmosphere that has lots of memorabilia, perhaps going back to the 1940s, 1950s, where many of our dementia patients, not all, will find a real sort of sense of, yes, I remember that. I look at a photo and I remember those people. And we were so lucky to have Richard Hawley, who is one of the actors from the famous Coronation Street. He plays Johnny Connor. The reason we invited Richard is that he had a very special reason for being there. He helped to support and care for his late father, who had dementia. And so it was a really poignant delivery and opening speech that Richard gave. We were also joined by a lady who was a volunteer who recently lost her husband to dementia. So it was bittersweet and sad, but it brought everybody who was at the opening back to remembering how much dementia really does affect lives, how much it robs people of their previous characters, and how important it is to get involved with supporting them through reminiscence in a relaxed way in our Dementia Cafe. So thank you to the fundraisers, and thank you to everybody involved in the cafe. And finally, you know that I like to finish my podcasts with talking about some of our fantastic staff and the things that they're doing that then gets recognised in awards. And we've got 2 nominations at final stage, and so I'm really pleased to be able to say that Dr. Catherine Aldred, who is consultant in speech and language therapy, has come up with a pioneering new therapy for working with children with severe autism. And that's an award up for the University of Manchester. And the other award is around how we can work together as a number of trusts in Greater Manchester around nurse agency recruitment. And so where we need to recruit additional staff to complement our substantive staff for perhaps a number of shifts, we work with an agency. And we've come together with a number of other organisations, trusts in Greater Manchester, and this work has now been recognised by the Health Service Journal, and we're up for one of their final awards. So good luck to everybody involved in those nominations, and you're a winner for us, even if you're not recognised on the night, because I absolutely understand that there's so much good work being done in the NHS. So thank you to you.